confident in terms of how you're going to, essentially follow this course with us.
Yeah.
I'm going to start off by sharing a bit of an agenda that I would show you now. And that would essentially mean that we will touch on these aspects of it as we go along during the course of our induction.
Yeah, that's fine.
Good stuff. So thank you for obviously choosing UK Versity to study the Access to Foundation Diploma in Nursing with us. So what we're going to do is look at a bit of a course overview, which is for the Access to Foundation Diploma in Nursing and Midwifery. That's what the full name of the qualification is. We're also going to look at some systems. These would include Zoom. You had no problems on getting onto it, which is great. So there's not much I need to, explain on that. But every time when we do these sessions, what will happen is you'll get a Zoom meeting link. You would not need to have any subscriptions. Just click on that link. In some cases, it will ask you obviously to register first name, last name, and your email address, because it also acts as a bit of an attendance for us and does that attendance system bit. But you should be able to, obviously then get on with it every time whenever you, join the sessions. I'm going to show you a bit of Moodle, which is our learning system. So this is our learning hub, as we call it. There is this website. Obviously, I'm going to show you that. And then obviously YouTube. That would be useful for you to access some of the teaching and learning videos, recorded sessions that we have. And then there is an app that you can also download on your phone. And I'm going to take you through that as well. There is a bit on assessment and feedback process. Ascentis is a qualification which is run and, essentially accredited by QA. So what happens in this qualification is you have only one attempt to be able to, get the assignment right. So the first time you provide a draft, we give you feedback. We can't declare the grades to you. Some units have only achieved or a pass, and some have pass merit and distinction. So in the graded units, you have an opportunity to obviously take some feedback and improve on the work, but it only allows for one resubmission. So anything beyond that would mean that your marks are going to be capped at pass. So I'll take you through that process because Ascentis is let's say it's an independent awarding organization, but they have implemented what is called the quality code. So part of the qualification and the body follows the guidelines with QA and the universities very closely. So that is where this is a bit of a stringency on, the assignments. There is going to be obviously formative and summative feedback that we'll provide from time to time when you do study the units with us, and that should help you to obviously improve your grade, or in some cases, obviously achieve the units. We are also going to look at some bits in terms of Q&A. So if you have any queries, questions, things that you need more information on about the course, we will, I will encourage you to essentially ask me as many questions as possible so that you are confident at the end of this session to start studying the course with us, comfortably. And then I'll also get you and basically get you, or in the sense, essentially just introduce the team. You will get to meet them in any case. So there will be people in the admin, which obviously are going to be quite, let's say, active in getting in touch simply because they will need to give you information. And some of this would essentially involve interactions with primarily you on email, WhatsApp, phone.
Yeah.
So the admin team essentially would be two people. Jill is the course coordinator. So she normally schedules all the sessions and you'll get these session invites. And obviously on the assignments and assessment tracking and coordination with lecturers, I've got Amandeep, who basically should be able to get in touch with you on phone and email, WhatsApp, with regards to any major announcements on submissions, deadlines. And then in terms of the tutorial team, there are 3 or 4 people which will be teaching the qualification. So I've got Shazia, most of the tutors will teach only their specialist units that they are, they are like say experts on or have been delivering for a number of years. You have Shazia, Anjum, I have Victor, myself, Rex, and Temi. So there are a couple of different tutors because there are different units and they are in different subject areas. but generally 5 subject areas, and I'll show you that as well, so that when we discuss the course overview, you have a good understanding in terms of which units are graded, which units are not graded, and in some cases, what are the units that you need to focus on, because let's not forget that you're doing this course because you want to get into nursing, and
Yeah.
this diploma essentially takes you to nursing. But in terms when you apply for UCAS and for admissions, what tends to happen is that most universities, obviously because of the grading scheme in the qualification, would prefer to have you achieve higher grades, and that is where you get preference first. And then if you have some units in which you have lower grades or just the pass grades, then obviously sometimes what they do is they put you onto a waiting list. So this is the bit that I essentially want to understand, and at a later stage I'll go into a bit more details to show, so that you are clear that for some of the units you're putting in absolutely 100% your best, and that should allow you to essentially achieve the highest merit or distinction grade on them.
Yeah.
Apart from that, I think if there is anything else which comes up, do feel free to ask me. But what I'm going to do is start you off with the systems first, and then we'll go into a course overview a bit later. So let me share my screen and take you to the website from where you'll be able to access all the systems. Now, just to put this into a bit of perspective, I have switched on the camera, reason being some part of this course is distance learning delivery. So I would need you to switch on your camera as well, just to see you, so that we know who you are. And obviously identity wise, it is important requirement from the awarding organization. That's great. Good to meet with you. I'm going to switch off the camera for some time, after some time, reason being the recording which does get created, it's a 45-minute session, probably bloats up to a gigabyte. So in order to keep the recording file size low, I would probably request you to also switch off the camera, and then as and when you have any questions, you can switch it on.
That's fine.
Thank you for doing that, and let's make a quick start. So I'm just going to shift you to show you the website first. So the reason I'm going to show you the website is because this will be more or less a starting point for you to get access to all the information. Now, I've just zoomed in slightly on the website to show you on the top itself, you'll be able to get hold of everything. So for example, if you need to reach us, there's an out of hours number as well. You are able to WhatsApp us on this number. This is a monitored mailbox, admin, which is short for admissions, and 4 or 5 people have access to the mailbox, all the ones in the college. So when you send an email to this email address, anything related to administrative query, or you need an enrollment letter, you need your registration, all those things could come to you pretty much, in 2 or 3 minutes, because this mailbox is monitored more or less Monday to Friday between 9 a.m. to 5:30, and over the weekends as well. There is a shortcut or a link to our Learning Hub, which is the Moodle that we use. So you can reach Moodle from here. There is a link to the YouTube channel as well. And should you wish to reach us, on the college switchboard, obviously these are the numbers and the address details are given at the footer. Now, my quick suggestion and request to you would be, for the duration that you're studying the course with us, if you just save this number as UK Versity on your end, because what will happen is most of the calls will originate from this number, and it is not going to be a marketing number. Sometimes we get mistaken that people are calling for marketing calls and stuff. But if you save this number in particular, most of the calls that we do essentially will come from here. We use a CRM system in place, which obviously helps us to keep track of all the activities. And when you do call us, it is not going to be a case of, okay, who are you? Where are you from? What course you're doing? Everyone will be able to see everything on the system, because it is a common dashboard that we share, and we know what your registration number is, what your address is, when you've started, what documents you've provided, what emails you're opening, what we are sending. We're able to send you a message, text message, things like that. All those things will be available to us here. So if you save this number, it's going to be easy, because when we do call you from this system, and it will straight away dial from 0161. So essentially it is not a spam call or a marketing call. It is coming in from UK Versity. Now, the other reason what I would do is started off with the website is to show you how you can bookmark some of these sites on your home bar, because these are things that you're going to use time and again. So at a click of a button, lots of clicks, but you'll be able to save on a few clicks. when you are actually trying to get access to information. So if I look at, if I click on this, it'll open up the WhatsApp straight away or ask you to, send a message to that. But for Moodle, if I click on this, it'll take you to Moodle. So what I would suggest is if you click on the lock on the top and then drag it to your bookmark bar, that should allow you to save, the website in terms of, as a bookmark or as a shortcut, essentially, for the purposes of getting onto it quite quickly. Now, the other bit which I will do is at some stage, when I click on Moodle, this will open up another tab. And here again, I would do the same because this is the main system that you're going to be using. So again, I'll drag the lock and essentially drop it to the bookmark bar. So that means, if you need to get access to it at a click of a button, all you'll do is click this and you'll get access to the Moodle straight away. And the last bit which I would mention here is the YouTube. The reason I mentioned YouTube is that most of these sessions that we do delivery on in terms of live teaching will typically be accessible to you from here. Now, the reason of doing that is, although we have recorded session on Moodle, but sometimes you would be able to get hold of, sessions from here, and they are going to be quite neatly labeled as, the units that you want to say, for example, search. Now, if I would look at, say, infectious diseases, just if you do a quick search, it'll bring up everything related to that particular unit, which has been delivered, and that would allow you to get hold of all the sessions related to them nicely. The other way would be you go onto the playlist and you choose the nursing and midwifery playlist, and that is where you'll see all the sessions for all the units that we have uploaded, and there are about 28 of them. But once you go through this particular delivery, you'll probably have, and you subscribe to the channel, what will happen is you'll probably have access to about over 100 videos, which are, essentially available for this particular program. So for the duration that because I'm signed in, for the duration that you're going to be with us, I would say subscribe to the channel, and that should allow you to get access, undivided access to the videos, which are related for teaching and learning on the YouTube channel. So these are the base, systems that I would suggest that you need to be aware of when looking at, obviously studying with us. As far as Zoom is concerned, you're using it. Website, simple enough to log in. There is nothing in terms of logging into the website. It's just a starting point from where you actually go to all the other sites on our system. Now, what you see is a Moodle, which is the Moodle homepage. And on this homepage, what we have is two videos which are outside. One of them is basically a short video to be able to set up the Moodle app on your phone. You can do this on Android or Windows, and it takes only about 30 seconds to set everything up. Now, let me ask you a quick question here. Are you a Windows or a Mac user?
Windows.
Windows, okay. So basically, in the case of Windows, and what phone do you use?
iPhone.
iPhone, okay. So basically, this app, you can download it from the Apple Store. It's a free application. It is the Moodle app, as it is called, with an M and a graduation hat. It's a free application. There are lots of free applications, but make sure that you develop or download the one which is from the developer called Moodle, which is the company itself. And once this app is downloaded, it takes about 30 seconds for you to set up this on your phone. All the material that we provide is downloadable. You can carry all the stuff in terms of recorded lectures, presentation, handout, books, wherever you go in terms of the access to the internet that you have. And having it on the phone essentially allows us to have one or two advantages. And these advantages tend to be that on the mobile devices, we are essentially able to send what are called push notifications. So these would be enabled in terms of reminders, calendar invites, and announcements that we can do, which will come up when you install the application. Now, there are three things that you need to install after you've downloaded. One, you need the URL or the web address of the Moodle where it is installed. And the second is your username. The third is your password. Username is always in small letters or lowercase. And password is case sensitive, and it will have to be at least 8 characters in length. So one uppercase, one lowercase, one special character, one number at least, and then thereabouts their combination, adding up to 8 or 9 characters minimum for a password. Now you can customize your notifications from the 3 dots which are here, Obviously, for us to be able to send something across, this app is useful, although not mandatory. And you can also switch off notifications if you wish to do so. And that's why I think sometimes learners don't use it. What we do is we obviously then add you to the WhatsApp group, and that is where most of the announcements or say meeting codes or session discussions typically tends to happen, but only in brief bits, because we don't want everyone to get those messages if there's a discussion that you need to have with, say, a tutor or with another person. Then the idea would be to do it offline off the group. But if there are pressing requirements that you want to mention or anything that you want to get hold of, then it's best to do it in the group, because there are 9 or 10 of you now who are studying this course for this batch. And then obviously some part of the information can be sent across by one learner to other, and that's how all communication is being done in the group. The second thing sometimes does happen on the system is that if you get locked out, or if you forget your username or password, there is a video that we've created which allows you to look at 3 types of reset on information. One is password reset. Second is a reset wherein you have cookies on your system, and because of the number of username and passwords we store on the system, sometimes it does not allow you to access or reset it. Then you have to clear your cache and the cookies, and that is where then you enter and ask for a reset link. And the third would be essentially to look at asking for a username if you forget that, and that would be done through this particular video. And one of the reasons why we put it outside rather than not requiring you to log in is because this is something which is done by the system itself. So simple click enough. Simple click here at this end. It'll ask you either your username or your email address which is associated, and that should allow you to get a reset link instantly to your email address. And then from there you can actually either reset your password or get it back into Moodle. Now, just very briefly explaining the system itself in terms of Moodle, and let me log in. So once I log in your case, when you log into the Moodle by putting your username on the top and then the password, what will happen is you'll see one course, that is the course that you are subscribed with on the system, and that would be under your My Courses. The other way of reaching the nursing course would be by clicking on the nursing tab. And obviously in nursing, we just have the access to foundation diploma in iNursing. And when you click on it, you should be able to get into the full course. Now, the full course has 14 units. The way the content is organized on the Moodle is pretty much the same across all the units. Now, today's discussion, apart from the demo of the systems that we do, is going to be focused on this area essentially, which is looking at the course structure, the overview of the course, and looking at some of the subject areas that you'll be going to be getting into, like healthcare studies, healthcare professional, human physiology, social issues, and study skills. These are the 5 subject areas in which you'll be studying a total of 14 units across this particular course. So we look at this in a bit more detail in the course overview section of it in a minute. Let's look at very briefly going through how the organization of the material, teaching and learning material for you is actually done on Moodle. Now, when you get into a particular unit, what you're going to see is the units are pretty much organized as in no particular chronological order, and we've labeled them as units 1 to 14. Sometimes you would see some units are hidden, and this is primarily because some learners are paying for the course on an installment basis, or in some cases, when you've completed the units, what tends to happen is the units get shaded or become passive. Active units are units which you will not normally be able to access. Now, within the units, you're going to see 3 different types of files. First type of file is going to be a PDF file, because these are version controlled and awarding body documents. They generally tend to be PDF. Second type of document is going to be Microsoft documents, either Word, Excel, or PowerPoint. These documents are provided in this format because when you click on them, it will allow you to download it to your machine or your PC or your laptop or your phone. Now, in the phone and tablet, these applications are associated. So what happens is when you click on them, it straight away opens. But if you download it on a Windows-based PC or Mac, and I click on this right now, what will happen is it'll ask me to, it'll straight away download or give you an option to download it. And the reason why this is done is because some of these are what are called templates, and we want you to use these to be able to use them when you try and submit your assignments. So things like the assignment brief, additional handouts, samplers, maybe in some cases templates, they'll all be available as Microsoft documents. The third type of document that you're going to see is a cloud document. That means if I click on this, I'm just going to open it in a new tab. What will happen is this will open up as a video, and this is a recorded session of the full discussion of the unit, but only a specific part, which is the specific learning outcome. We don't teach the whole unit in one go. So what will happen is you'll have each of the units broken down into learning outcomes, and these lectures are video lectures. They typically are recorded with the PowerPoint slides and the tutor and some of the learners actually talking you through the lectures itself. So when you attend some of these lectures, we are not going to be reading from the slides. It's a case of obviously going through the slides and the content required to be studied in the units, but we will discuss practical examples, case studies, frameworks, so that you have a very good understanding in terms of what is required to be covered. These lectures can vary between 25 to 45 minutes to an hour long as well, because some of these lectures tend to be quite detailed, depending on the indicative content that we need to cover in the units. Now, this kind of a layout will be present in terms of different files across all the units. In some units, there might not be certain documents or certain types, simply because these units have to be taught and delivered again and again. And obviously, in some subject areas, we need to do these live lectures simply because we would probably change the topics, or in some cases discuss things which are flexible, and we have to rotate these topics to be able to avoid plagiarism. Now, when you look at some of the let's put it this way, the way in terms of arrangements of content on the unit, you're going to see that there is a unit specification in all cases, which will be ending with the word unit specification. There will be an assignment brief, which will be a Word document. In some cases, there are workbooks which are also available, which are for additional reading provided by Ascentis. And then you have PowerPoint presentation followed by lectures. There are some handouts underneath each of the learning outcomes. LOs stand for learning outcomes. So if I open this one up just for showing, as you can see, this unit has 3 learning outcomes, 1, 2, and 3. So we'll cover this unit in about 4 lectures. That means one lecture would be essentially assignment discussion, but the other 3 lectures is going to be the learning outcome discussion and the assessment criteria associated with it. So what tends to happen is, when we look at making the presentations, we basically break them down into learning outcomes, or LOs, learning outcome 1. So this will discuss all the indicative content given in the unit specification. We'll cover some key terminology, we'll look at a video, and then obviously in some cases look at covering the contents in detail so that you are able to get a very good grasp of what is required. Now, generally the initial slides tend to be theoretical frameworks or key terminology and general discussion about the learning outcome. And at a later stage, what we do is we get into individual criteria. So you also understand what these criteria would require you to cover and understand from a point of view of also doing an assignment at a later stage. Now, this learning outcome had only one assessment criteria, and that's why the presentation is that. And last but not the least, in some cases, what will also be seen is that we have books which are integrated into individual units. And wherever workbooks are not there, what you'll generally see is we've also created a lot of handouts which will allow you to read and get additional information which is required for you to master that unit or gain the knowledge and skills required in studying those units. So that's this kind of a layout in general is going to be across all the units that you're going to see. Sometimes what we're also doing is we are breaking the sessions up into different parts. The reason is, if I look at this unit, which is one of the main units of nursing aspects of human physiology, now I teach this unit in 3 or 4 lectures because there are 7 different systems that you need to understand. And for us, or for some of us, it's back to school because we studied this in biology during our after our GCSEs or during our AS or A levels. So, these systems will require a bit of time. And obviously what we don't want to do is have the lectures too long or too short, or cover it up too quickly. And sometimes what we'll do is break these lectures down into various parts, even in individual learning outcomes. And they will allow you to then systematically and structurally study the course content with us. Now, there are 14 units. We'll teach them in no particular order, simply because what we want to do is get through the easy units first, wherein the assignment requirement is about 750 words, 1200 words, or maybe 1500 words. And these units will also form the foundation of how you're going to, pick up some of the skills required to, start writing assignments, referencing, and, even researching, because some of the other units that you're going to study at a later stage would require them to be used actively to essentially, cover those units. Is that okay? So this is what is going to be Moodle, more or less entire content, course, recorded lectures, everything is going to be available from here, and it is going to be unit by unit. One thing that you'll have to look at is sometimes there is a yellow colored box which will be around one particular unit. Now, this yellow colored box will actually tell you that this is the unit which is currently being delivered live, and you would receive Zoom session invites from my colleague Jill, and that will inform you that this is the unit for which you should have the invites to be able to join the live lecturing or the sessions which the tutor is going to be doing. So, for example, the next unit that we are looking at starting is the Equality and Diversity unit, and this unit is going to be starting this weekend, and this is the unit that you will be having access to, and this is the unit that Shazia will be teaching. So you'll go through this unit with her on Saturday and on Sunday, and then subsequent week, Saturday and Sunday, and obviously that will help you cover this particular unit. So the yellow colored box is to give you an indication that this is the unit that you are going to be studying, or for which we are delivering live using Zoom meetings. Now, one quick question here. You've got the access to the course, isn't it?
Yeah, I have.
Okay, that's great. And you've been able to log in and basically just go through and see some of the content on the system as well.
I've not checked that yet. Logged in. I'm sure it works when I log in.
No, that's fine. So you can do this maybe today or tomorrow, and then Saturday would be the session. So that's absolutely fine. Now, this is what probably more or less the systems part of it is, as far as teaching and learning of content is covered, and how the access to the content would be provided. So the website, which is a starting point, looking at Moodle, which is where your learning content is, looking at using Zoom to which you can be able to, through which you are going to attend sessions. If you miss out on any session, they're all recorded. You have a copy of the recording available after the session in the WhatsApp group. And Aman, who's the course coordinator, will actually be sending copies of recording on email after these sessions have happened. So, for example, these sessions happen on Saturday and Sunday. You would have had 2 sessions. And what Aman would then do on Monday when he comes in is basically send you a copy of the recording, just as a subtle reminder that these are the sessions which have happened, and you have them at a click of a button. And then the Moodle app is optional. You can install it on your phone should you have time when you're traveling, or if you use public transport, then sometimes it's easier to put on the headphones and obviously go through lectures you've missed out by listening into the recordings. But that's pretty much it in terms of the systems that you're going to look at as far as the teaching and learning and content side of things is concerned. Is that okay?
Yes.
Okay, good stuff. Now let's go across to a bit of a course overview. Now, first thing which I'm going to show you in terms of the course overview is the course structure. And the reason I would show you the course structure is that this will help you familiarize with how the course is going to be run, what are the units that you're going to be studying, and at some stage, who are the tutors, assessors, and people across the qualification. So I've opened up what is called an Excel workbook, and that has the units and the categorization of the units across the various subject areas, or streams as I call it. So here there are 3 units that you're going to be studying, which are called study skills unit. They are going to be academic writing, academic research, and ICT skills for higher education. These are study skills unit, which are units which will allow you to use the systems, become a bit more proficient with the use of Word, PowerPoint, and Excel, how the use of IT is done in education, specifically at some stage in nursing as well. And then part of this, what we'll do is when you come into the center, They're also going to show you some of the instruments that you're going to use when you do a training to become the nurse. Academic writing and reading skills research skills are important because of the fact that you're going to be researching articles, case studies, journals, books, and websites to be able to glean and obviously bring content into your assignments. And that is where you need to be able to understand how research is to happen, what is the relevance of research, and how can research be used to obviously write assignments. And when you do academic writing, it's about referencing, it's about understanding how do you do paraphrasing, and then to a certain extent also understand how do you start writing in paragraphs rather than bullets by building arguments, and then giving credit to authors, publishers, scientists, journalists, psychologists who you are taking the work from in doing your assignments. The second part of the units that you're going to be doing is units which are related to social care or social issues in healthcare. And here we have 4 units that you have to study. These 4 units will include health and social care provision, which is to understand the structure of the NHS and how the health and social care system works in the UK. What is the provision of healthcare? What is the provision of social care, mental health services, and in general, understand that as a structure. There is effective communication, which is a big thing within nursing and any career related to the NHS. Communication skills are important, so you'll be learning about effective communication skills and various things in terms of theoretical models, backgrounds in this particular unit. Safeguarding is a big topic which has come up and has now got recognized after the CARE Act was introduced in 2014. So safeguarding is a separate unit that you will cover in terms to understand how do you safeguard and work with individuals while providing care, giving them independence, dignity, respect, and ensuring that their privacy is taken into account. And if you do feel that there is abuse, let's say neglect, or harassment or bullying happening, then how do you sensitize individual people or your superiors so that relevant action can be taken? And this is to be done not from just the organizational point of view, but from a point of view of even when you work as when you work in roles like social workers who visit homes, or when you are attached to councils and NHS. So that whole unit will cover the concept of safeguarding in health and social care. There are 2 specialist units that you're going to be doing in the area of human physiology, which is infectious diseases and human physiology. These are core units in which there is grading, and it is important for you to, obviously look at scoring good marks simply because of the fact that these units are considered core units for nursing, and that is why they are that is why they will have 6 credits, and also they are a part and parcel of your human physiology side of things. So when we look at other graded units, you're also going to see some units which are graded in healthcare studies. So brief history of medicine, equal opportunity and diversity, and social and community welfare provision are also graded units. Introduction to issues in health and social care and professional healthcare services and practice. One of the units is graded, one of them is only a pass. So out of the 14 units that you essentially study in the qualification, I think 7 of your units are graded and 7 are non-graded. Let me confirm that to you in a second. 1 minute. So just to look at the grading of the units, so that we are clear that these units are graded. I am just going to include another column here, which is to say graded, ungraded units. So this particular thing that you see, which I'm showing you right now, is also going to be available to you in Moodle, and this is the reason why this will be available to you is primarily so that you clearly know that this is a graded unit. So these units are non-graded, ungraded, only you can achieve. So you have to achieve these units. You cannot fail any unit here in any of the qualification. Then we go to social issues. So if I go to social issues in health and social care, sorry, here we go. That's ungraded. And then we also have 1, 2, 3. So introduction to professional healthcare services ungraded, and 1, 2, 3, 4, 5. So these 5 units are essentially ungraded. 9 of your units are going to be graded. So they will be graded units with option of pass, merit, and distinction that you can achieve. So that's how I would put it this way, that the higher grade you get more UCAS points, in those units. And that is why it will be essential for you to consider them while you're attempting these particular units. Total units tend to be 14, and these 14 units would essentially add up to 60 credits. And these 60 credits would, get you different UCAS points as far as, when you make an application to the university for the purposes of applying to get into PSc nursing degree course at some stage. Now, this tends to give you a bit of an overview of the unit in terms of, what the unit and unit structure is. And this is something that will be available on Moodle. Now, if I just quickly shift you back, but let me just download it rather than shift. That's also an Excel, document. And what I'm going to do is open that document and share that with you. That document allows you to clearly see what units are carrying what, say, credits in terms of how much, credits each unit has. So if I look at this particular structure of the diploma, here, anything which is ungraded, these are the 5 units that you see are ungraded, and these are all graded units. It also shows you the credit value per unit. So some of the units like human physiology, infectious diseases, principles of safeguarding, you look at health and social care provision, community health and social care provision, these units are on a research project. These units are 6 credits. That means they have more weightage than some of the other units, and these are the subject areas. So study skills, introductory unit to healthcare, healthcare studies, social issues in healthcare, and human physiology. These are the 5 subject areas. Across that, you have 14 units. These are the unit IDs. They show you whether it's graded or not, the number of credits, and obviously total number of credits that you are going to score in the diploma is 60. 45 of them are graded and 15 are ungraded. So if you are able to get a higher grade like merit oblique distinction in some of the graded units, that would mean you get more UCAS points and preference with universities with regards to admission. Is that okay?
Yeah, that's fine.
Good stuff. Now that helps us understand and basically cover some part of our course overview. But what I also want to do is, in the course overview, I want to basically look at also mentioning, bits and pieces related to some of the workbooks which are there, and they are going to be useful for reading, specifically when you, get into the course. So what we've done is we've uploaded the subject area-wise workbook. So when you click on the healthcare studies, professionals.
Is this all on Moodle?
These are all reading, yes. They will be useful for you to just go through them. They are basically, schemas or outlines of the units that you're going to study. You might not need to read all of them, but you would need to understand that what are the units you're studying in what subject area. So for example, when I look at the healthcare studies as an optional, as a subject stream that you're going to study. So in this subject area, you're reading a brief history of medicine, your effective communication skills, social and community provision. These are the 3 units that you are, reading in this particular subject area. Now, when we look at what the units will consist of, it will give you some guidance in terms of what is going to be covered in these units when we do teach them. So they are documents which are going to be useful just for the purposes of going through and understanding the unit and the subject that you are studying falls in which subject area, what credit it has, how many learning outcomes it has, and say, for example, what is the indicative content which will be taught for you to gain knowledge in that area. Okay, so these are just for, I would say, bedside reading. You could probably flick through some of these course handbooks by going through and understanding the units, and that would be good enough to begin with. Is that okay? They are a part of the course overview essentially, so that you know exactly what you're studying, what units you are studying, and how much credits they have, and what subject areas they're in. That is the reason of, obviously looking at, going through these course or subject handbooks. Is that okay? The diploma structure that I've shown you is basically given here, and that is something that is what you can refer to and reference to, and that would be useful for the purposes of having a ready reference of the names of the units, whether it's graded, ungraded, and credit wise. That would be the idea of looking at the diploma structure. Okay.
Yeah.
So that bit helps us go through some of the course overview, if that's okay. Now, in the course overview, I also would like to mention that there are obviously our own quality policies that you can do, that you can refer to from time to time, and they would basically give you things and give you information about things like, when you look at assessments, we look at plagiarism and scanning through Turnitin. Now there is an increased focus on AI detection software as well, because you can write or get work written through AI software. So that bit of checking of plagiarism and AI detection is done as a mandatory requirement from the awarding bodies at the center. So you have to be very sure and clear, stay clear of obviously writing or taking words or let's say writing text or paragraphs from AI software like ChatGPT. If you do use it, you have to paraphrase it, make sure you reference it, and that makes it your own material or evidence, and that would be acceptable. Now, there are bits and pieces on requirements for distance learning, which I believe you are able to meet because you're based in the UK, internet and bandwidth, and obviously systems are available. There are bits and pieces on safeguarding policy. If you do feel that you are being pressurized, harassed, bullied, or being asked to do something, then which is not something that you want to do, then you can also raise it with the data, safeguarding officer in the at UK Versity, who's Philip Hodgkinson, and he would then take appropriate action. So there are bits and pieces that you can use in the policy should you feel that you are not being dealt with, or you're not being given the right treatment or being respectful, things like that, and they would be useful at some stage if ever anything is to happen in that context. Not that there will be something which will happen, but obviously as a provider, we have to provide these policies so that you are aware that if there is a need, then you know the process and you understand how this will be dealt with within the organization, and you are able to then reach out to the relevant person to be able to discuss this in confidence. Is that okay?
Yeah, that's okay.
Now, one or two things, obviously you'll get to meet some of the staff in any case, but most of the faculties are listed on the website. This is Shazia, this is me, obviously some of the other tutors, Anjum, Temi, and then we've got Rex, who would be teaching, Daniel and Dr. Elvis. So we've got a very experienced faculty on health and social care and nursing. Dr. Elvis is the head of nursing in Bolton University. So at some stage, he does guest lectures with us, and obviously he's an old colleague. So, you'd be able to interact with him if he does any lectures with us. And this is Victor, who does the IT unit. So you'll get to meet and see most of the lecturers during the course of your sessions. And obviously in the operations team, we've got some of them listed here as well. She's Jill, she'll be the course coordinator. Arjinder maybe at a bit later stage because he does most of the administration, dispatch of your diploma, certification. Aman is the one who basically looks after, scheduling, sorry, not scheduling, but coordination in terms of WhatsApp group and, assessments and assignments, tracking and things like that. And you'll be able to get in touch with most of them through the email, phone, or WhatsApp. Now, I have also added you to the WhatsApp group. So you have access to WhatsApp in any case, isn't it?
Yes.
Okay, that's great. Now, let me just go back and quickly show you the assessment and feedback process, how that would work when you come to a stage at a later time in terms of submitting your assignment. Now, what tends to happen is, in most cases, what we do is, let me just show you and switch you over. So what I'm going to show you is one assignment. Now, in the assignment briefs, which are basically up on Moodle, when you click and download any of the assignment briefs are 6, 7, 8-page documents. The reason is, unlike other awarding organizations, what Ascentis has done is basically ensured that anything to do with the assignment declaration, learner declaration, all those bits are actually integrated into the assignment brief. And that is why it is provided as a Word document. So the first page is basically your assignment details. That means you write your name, center, name of the unit, subject stream that you're studying, your unit code, and then obviously your date set, due date, and when you are submitting, and then you sign to the word count. And that is the bit that you do in the first page of the assignment brief. The second part is done by the IQA and the teacher who's assessing and confirming the grade, and that will be done by them. Now, the second, third, fourth page tends to be the assignment brief, and they have a scenario-based assignment brief wherein in most cases you are given some background information, and then on the basis of that information, you're asked to complete certain tasks. Now, this is where what you see is there was a case study which was given, and the case study has been used to essentially do the assignment, and that is what the learner has actually done in the assignment brief itself. And what I am doing is I'm just scrolling down and I'm going to show you how the marking happens. So the learning outcomes are given in the assignment brief, which is to be used by the assessor or the tutor. We will give you feedback on the assignment brief. We will also look at the grading on the assignment brief, which is done by the tutor. And then grade descriptors. How do we grade? It is very clinical. We cannot introduce any personal judgments from our side. The grading descriptors are also given for the learners and the assessors. As long as you are meeting these criteria, you should be able to hit that grade. And then what is covered for merit and distinction if the unit is graded is also given. So this whole part, as you can see, is an assignment brief. But within that, the learner has also done the assignment. So where the assignment is actually then, the evidence part of it is actually being done by the learner itself within the brief. And this part is quite important because if I show you now a blank document of the same unit, which is effective communication skills, and I want to show this to you, reason being so that you're aware that this is how generally, the assignment briefs are provided. I'm going to try and share my whole screen so that you are able to see it. Just give me 1 minute. I'll try and minimize some of the other documents that we don't need. So when I share my screen now, what you're going to essentially see is the two documents. There we go. Now, just to rearrange slightly. So this is the assignment document, which you see here. This assignment document, as you can see, is basically a document wherein it is introduced by Ascentis. It's a blank document, and there's an assignment brief on page 2. Then there are learning outcomes which are given, then commenting for the tutor, grade descriptors, grade profile. Now, this whole part is going to be an assignment brief, right? Now, when you do your assignment, that has 4 or 5 elements into it. There is a cover sheet or a front cover sheet, which is like a declaration. Then there is an assignment brief, which is given. Then for the tutor, the grading criteria, grade profile, descriptors, and commenting places are given. Now, when you get this and when you download this from Moodle, you're going to do the assignment in the same document. And this is how the learner would do it. So they will fill the relevant parts up here. There'll be some parts that you'll fill here. And then under the assignment brief here, what the learner has done is inserted a page and then started to do the assignment. Can you see that?
Yeah.
Yeah. And then when we get this document back, this is a working document right now. And what we do is we do commenting on the right-hand side. Now, it is easier for me to not have an assignment brief, a unit spec, and for the assessor is also easier because I can see the one document, go back and forth and check whether you've done 1.1, whether you've done 2.1, 2.2, and then I can do relevant commenting all in the same document. So essentially, when you do your assignment, when you submit it to us, we are going to send this document back to you. And when we send this document back to you, what you're going to see is that this will have some annotated comments on the right-hand side. Now, this is only visible if you open it on your Windows or on a Mac on a full screen, not on a tablet or a phone, because the screen space is small. So these comments would be available only as blobs here, and you won't be able to see what has been written in the blobs. So when you open this up, it shows you the commenting which the assessor has done. And if you have met the assignment, we will always say met or achieved, and that would go to show that you have achieved this unit in summation of your assignment. Okay, and then at some stage a grade would be mentioned here, or what have you received as a grade, that would be mentioned here. And this is then, once you've got this, what I would, or one of the assessors would do at some stage would be to basically then send this back to you, but send this back to you as a PDF document, simply because this is now signed off. And this signed off document means that you are able to keep this as a proof at your end. And it will also have been verified by the assessor. And that would mean that this unit is now finalized, as you can see. And this is your proof or record of that I've completed this unit and I passed and I can move on to the next one. Is that okay?
Yeah.
So the feedback process consists of two parts. First part, looking at getting you formative feedback to say your outline of the assignment is fine, you're meeting the criteria. In some places, we might ask you to add content. And when we do make a comment here that, okay, this part is fine, but you need to add an example or relate it to the case study, and you make changes to it, then what you do is you highlight this in yellow. So we know that that's the comment that we did, and that is the additional bit that you added to the work to make it now meet the criteria. Is that okay?
Yeah.
So sometimes you will need to highlight the comments or the extension that you're adding in terms of additional evidence into the assignment so that it's easy recognizable and you are able to then send it back to us and we are able to quickly turn it around. Is that okay?
Yeah, that's fine.
Good stuff. Now, taking you back to some of the last bits on the discussion with regards to the enrollment and induction session. Now, where do you submit assignments? It might be a question in your mind. Where do you submit the assignment, or how do you do it essentially? Where and how? Both, right? So
Yeah.
what you're looking at is the assignments are submitted to an email address called learnerwork@ukversity.co.uk. Now, this is a monitored mailbox. The reason we ask you to submit here is when you send an email, you get an acknowledgement to say that your work has been received. Now it has been, it automatically gets forwarded to the relevant tutor who has taught that unit, and that tutor will then mark your assignment and provide you feedback in 5 to 7 working days. So while you're fresh with the content, you should be able to get that feedback. And if there are any changes required, you should be able to do so. And those changes then would then allow you to achieve that unit.
Yeah.
Okay. Second, what is the turnaround time in terms of assignments and assignment submission and assessment? It generally tends to be 5 to 7 working days. Okay.
Is that how long you have to do the course, like the assignment?
No, that means when you
to submit
submit
it.
the assignment to us, we will turn it around and give you feedback in 5 to 7 days.
Oh, yeah.
Right? The next question, which you have already asked, is an important one. How, much time or when do you submit the assignment? So in this case, when do you submit the assignment? If we are teaching the unit and that unit has 4 learning outcomes, we will have about 5 sessions to cover that unit. So for example, you're going to start this unit on Saturday, which is equality and diversity. And equality and diversity has 4 learning outcomes. So we will cover this unit in about 3 weeks, right?
Yeah.
After the unit finishes, that means after the assignment discussion session has happened. Because what we do is, after we teach the learning outcomes, what we then do is discuss with you how to put together the evidence. And that discussion is called the assignment discussion. So give you tips and tricks in terms of what to do, how to do it, how to refer to some of our slides, where do you get the work from, and how do you then compile the evidence and send it over.
Yeah.
That last session is called the assignment discussion session. Now, once that session happens, you have to submit the assignment within 2 weeks of that discussion. Is that okay?
Yeah.
When do you submit your assignment? Once the unit delivery is complete, you had the assignment discussion session, assuming equality and diversity will finish towards the last week of October, you'll or in the 3rd week of October, you'll have 7th of November to be able to submit the assignment. 14
Yeah.
days. Is that okay?
Yeah, that's fine.
Good stuff. Now, one of the last question is, if you have queries related to the course, or the unit that you're studying, where do you send them? You send them to learnerwork@ukversity.co.uk. Simply, again, it's a shared mailbox with all the tutors. Depending on what the query is, which unit is, who's teaching it, they will respond to you in a couple of minutes or maximum 2 hours, and you should get a response on the email pretty much straight away. So this email address and a couple of other email address, you need to make sure that they are not going to your junk or spam folder. Simply because they will be sending emails to you frequently, and you would be sending emails to them frequently. So they need to be on a safe senders list.
Just them 4.
Just them 4, to be honest, in terms of most of the communication that will happen.
Yeah,
Now,
just idea.
Also be to the tutors. Now in University, it's very simple to write to any of the tutor. So whosoever is teaching, if you take their first name and write to ukversity.co.uk, that email will go to that tutor. So if you have to write to Shazia, it will be Shazia@ukversity. If you have to write to me, it's Raman. If you have to write to Anjum, it is Anjum. If you have to write to Temi, it will be Temi. Rex will be Rex. Victor will be Victor. So that is how most of the emails are, and it's easy to reach if you just use the first name of the person and write followed by a footer at ukversity.co.uk. Okay.
Yeah.
Now, the study plan is clear. Study plan is we have sessions, via Zoom on Saturday and Sunday. And these are at fixed time of 10 a.m. to 11 a.m. Now, when we send these invites, they're normally all for one hour in terms of duration. But that does not mean the sessions cannot last over an hour, or that does not mean the sessions cannot finish early. Generally, depending on the tutor and the unit and the content that we are teaching on that day, including the learning outcome, the sessions generally range between 35 to 45 minutes, and in some cases to an hour. But if it goes beyond an hour, we normally stop the session and we'll do it in different parts. Learning outcome part 1, learning outcome part 2, and so on and so forth.
Yeah.
Is that okay? Now,
yeah, I had a question.
Yeah, go ahead.
Yeah, I think you're doing it now. Saturday and Sunday, is it all online? And then the rest, you have to come in or something?
Good question. So Saturday and Sundays is online. These are online sessions, right? We will also discuss and give you a schedule. That might not be this term, but next term, we will also give you a schedule, which is January onwards, once you've covered most of the theoretical units. So for 2 or 3 units that we teach, we need to bring you in the class. And these sessions typically happen on a Friday between 10 to 1 p.m. So you'll have to be here at the college in our premises for 3 hours.
Yeah.
And a proper timetable for that. So you would exactly know what units are being taught, who's the tutor, and obviously in some cases, they will require you to be present. There are recorded lectures for them as well, but it will be preferred that you are able to come in and obviously attend some of them with us, which is going to be useful because you get to meet us face to face, you meet some of the other learners face to face, and obviously that is going to be useful from a point of view of doing some practical sessions and, other bits which are required to be done in the course.
Yeah, that's fine.
Okay, that's an example of a timetable that we will send because obviously Fridays will be in class, Saturday and Sunday will be Zoom meetings, and you will be able to, then clearly know what days or when, in what term you will have to come across, to be able to attend these sessions.
Yeah.
Is that okay?
Yeah.
So we have a timetable, but that is something that we'll firm up in the next couple of days after speaking to most of the learners. We don't want to move Friday, but sometimes it could be a case of democratic process wherein if there are 9 of you in this cohort and 5 of you say I can do Thursday and 4 of you say I can't do Thursday, then we'll have to do it on Thursday because most of you are able to come in. We won't be able to split the sessions or classes into 2.
Yeah, so normal lessons are on Saturday and Sundays 10 till 1 hour. Yeah, 11. Yeah, that's fine then.
Is that okay? So
Yeah,
that
that's fine.
helps me pretty much cover everything that I want you to go through with me on the course enrollment.
Yeah.
And this induction session then helps us cover things like, obviously a bit of a course overview, about the assessment and feedback process, who the team and the key people are, obviously some key questions that I wanted to make sure that and then the tutors or the tutorial team, and then last but not least, the study plan, which allows you to adjust nicely into the course.
Yeah.
Good stuff. Now, if you do think of any other questions or if you think of any questions or queries after this session, feel free to write into me on the email. And what I'll do is I'll come back to you. But later on today, you'll be getting the schedule from Jill. She will be sending you the schedule for equality and diversity so that you're able to.
I think she sent it me already. It's on my first one is
That's
on
great.
the 23rd September.
That's great. So that is the first unit. And every time what we do is when we schedule a unit, we'll send you unit by unit. So once you complete this, you'll have a schedule for the next unit. And then you can add it to your WhatsApp calendar as well if you want to, or sorry, not WhatsApp, sorry, your iPhone calendar. And that will allow you to essentially know and get reminders when these sessions are happening.
Okay, that's fine. So is that my timetable for the first
term? Yeah. No, this is just the timetable for the next, I think, 4 weeks or 5 weeks that you've got from Jill.
Okay, that's fine. Thank you.
Good stuff. So thank you so much for attending this session. I'll send you a copy of this recording in a couple of minutes just after when we close. And then I will look forward to catching up and meeting up with you during some of the teaching sessions.
Yeah, thank you so much.
Thanks. Take care, Mehwish.